Hi, today we'll be talking about in vitro fertilization, aka IVF, and I have a special guest here, an IVF specialist. I'm Dr. Daramola. I'm a family physician, and I'm honored to have here my old friend. She is triple qualified, so she's a gynecologist, she's an obstetrician, she is an IVF specialist trained in the UK for that, and she is a family physician as well. So she has reinvented herself so many times, you know, it's unbelievable. So I'm bringing this genius brain to you today to share with us questions that we have about IVF, and it's going to be exciting. Dr. Abera, thank you for coming on board.
Thank you so much, Dr. Durams, as we popularly know you.
Yeah.
And it's nice to be back together.
I'm really glad you're here.
Yes.
Thank you. So,
hi, audience. Yeah.
What is IVF and how does it work?
Right. So IVF is just an abbreviation for in vitro fertilization, and it is one of the techniques under assisted reproductive techniques. So IVF is just a general term which we tend to use in Nigeria for all form of assisted reproductive technologies, but it is just one of the many techniques available. Okay, and it is a process in which a woman is stimulated to produce gametes, and those gametes are retrieved outside her body and mixed with the partner's sperm or the husband's sperm or donor sperm in the laboratory. So the fertilization of the egg occurs in the laboratory outside the body, and then the embryo that develops is one way or the other transferred into the body of a woman to become a baby.
In the last 10 years or so, the IVF industry has kind of boomed. It's really blown up, and people are more open to it. I don't think we've ever had it so good for the IVF industry. Yes. Why do you think that is so?
Well, you know, in the African setting, there's a high premium based on childbearing. You can't just say, oh, we're married, we don't want to have children. People love to have children. And so there is a big need, because the infertility rates are actually quite high right now. With the technology, you know, use of technology, people are less healthy, and so people are less fertile. Also, people are marrying later because they're either studying, or so people are marrying at a later age or trying to conceive at a later age. And so that has created a sort of bigger infertility group. So, and then as technology and knowledge is expanding, success rates are improving. And as people are becoming more knowledgeable about IVF successes, they are more accepting. So I believe that is why
it is like that.
It is more popular now. People are more willing to try it.
And I think the culture is also evolving.
The culture is also evolving,
People are less African, less Asian, more European,
let's say
more American.
They are more enlightened, more accepting.
More accepting of non-traditional methods.
Yes.
Because in the past, you just get a second wife or a third wife or a fourth wife.
Yes, I know.
But
and women are better empowered now.
Yeah, a lot of times it might even be the man that has a low sperm count. So all these multiple wives.
50% of the time.
Yes. So all these multiple wives will just go and get pregnant outside, bring it home.
Yes.
So the first wife is the one that will tell the second wife, this is how we do it. Right?
Yeah. I agree. I agree. Okay. So yes.
So what are the success rates for IVF, especially for different age ranges,
groups,
and what health conditions affect these success rates?
Yeah. So first of all, IVF success rates, the major determinant is the age of the woman. And when I say the age of the woman giving the egg, as well as the reason for the infertility. So when you say couple are infertile, you say a couple is infertile when they've not been able to achieve a successful pregnancy despite regular unprotected sexual intercourse. And infertility rates are so high these days. Up to 25% of couples are infertile.
Wow, that's a big one.
That's a big one. So, meaning they are not able to achieve a pregnancy. And so, and the causes of the IVF is 50-50. 50% due to the male, 50% due to the female. So it's equal. It's not like most men are the causes, but usually combined.
What percentage is due to aye, what percentage is due to spiritual
the aye factor,
or stress factor, or the aye factor?
We're going to put the aye factor under the undetermined, right? Like unknown causes. And so that is what determines the success rate of IVF, like the cost of the IVF, the age of the woman, the cost.
So what's
IVF.
the best age? If let's assume I'm a woman and I'm trying to get pregnant and it hasn't happened.
Yes.
At what age would you think I should start considering IVF?
I'm hoping this conversation would have been. I'm hoping that all girls about 18 already know what we're going to talk about. So the best time to conceive is before you are 35 years of age, because your eggs have been there right before you were born. So the age of your eggs, which determine the quality of the eggs, as old as you are.
Wow.
And the older the woman is, then the older the egg is, the quality of the egg.
Yeah.
And of course, the quality of the sperm also matters. Quality of the sperm, because you can't have an embryo without sperm, and you can't have an embryo without the egg. And so
what you're saying is, once you clock 35, you should start seriously.
Well, I will say yes. No, I won't put it that way. I will say that once you're 35 and you've been trying to conceive for 6 months and it is not happening, then you should be seeking medical help. Okay. So IVF is kind of like the end of the spectrum. There are many things you could do before IVF. Things like ovulation induction.
Yeah.
Things like timed intercourse. Some people are not even aware of their fertile periods, It's amazing how many people in Nigeria are not even aware of how the menstrual cycle is.
Yes.
So many things to consider before IVF.
Now, the few patients that I've had who requested IVF, they're actually less than 35.
Oh, yeah.
Right. So, and there's a trend in my practice here in Canada that my patients tend to want to go back home, either to India or go to Nigeria to go and do the IVF. And I have stories of people who have successfully had IVF. So why do you think we are having this reverse medical tourism for IVF in Nigeria? I know that for sure.
Yes.
What's responsible for that?
Well, I want to say that the factor determining the age of your patients and people seeking help faster is due to enlightenment. Okay. Before, people would keep on praying without doing anything about it, but and I know that faith without works is dead. So a lot more people are more accepting of medical care. So that would explain why you are getting younger people acknowledging and accepting that, yes, we need this reproductive assistance and seeking help. Not suffering in silence. All right. So what was the other question? You said the
reverse medical tourism for IVF. It's a big. The IVF industry in Lagos is big now.
Big in Nigeria.
You used to be with the bridge.
I used to be with the bridge clinic, and I was there for about 6 years.
They're kind of on forefront with the IVF.
And I've experienced that in my practice here as well. A few couples I've seen here, they've consulted me because they know I was in bridge clinic, and so I would say, yeah, you could go home and have that. So I want to say that in Canada, we don't really have people who have children in Canada love their children. However, there's a higher premium paid on childbearing back in Africa. So the IVF practice, we don't have such a long wait time compared to Canada. If you're going to have IVF treatment in Canada, there's kind of a wait time before you see the physician, before you do your testing.
That's true.
And the cost is one of the reasons why people go back home to have it.
Okay. So if you're bringing Canadian dollar or US dollar or
you'll probably be able to afford it better in Nigeria.
Than in Nigeria.
And then the other thing I've noticed is, back home, now we're getting better regulation restricting the number of embryos transferred. Okay. So the European recommendation is that one good quality embryo be transferred into the uterus each cycle.
Okay.
Back home, the regulation is not yet that strict. But I know AFRH, that's the African Reproductive Society of Fertility Physicians, is working on creating regulations to restrict the number of embryos transferred per cycle. So people think the more, the merrier. That's the African thought.
Okay, so I can assume that in some clinics in Africa, people will do 2.
People are not following. They are doing 2 or more embryos,
3.
which unfortunately leads to higher multiple pregnancy rates, which now increases maternal morbidity and mortality.
Oh, okay.
which we already have high already.
Right?
So abroad, everybody follows that recommendation that one embryo transfer per cycle.
You lose your license.
Otherwise,
right?
well, the woman may not even successfully carry the pregnancy. But back home, I feel people travel back because there's more liberality, and then for people who need donor oocytes, they are kind of more accessible.
Those are eggs, right?
Yes, eggs. Sorry, I'm talking to the layman. Yes. So more accessible.
So more people willing to give you
eggs, and you are more likely to find a match that resembles you.
That is true.
That is true. That
because
resembles
of the genetics,
you.
right?
And then, of course, of significance is the cost.
Okay. So, what are the risks and potential side effects of IVF?
Of IVF, okay. Like we know, pregnancy is one of the leading causes. Well, that is what causes maternal morbidity and mortality. Okay. And IVF is a process where you are trying to conceive. So, it is a risk factor for morbidity and mortality.
Okay.
And then people who are coming in for IVF are coming in often at a higher age. So they are getting pregnant at a higher age, which increases risk of medical conditions in pregnancy, hypertension, diabetes in pregnancy, increased risk of miscarriages, increased risk of pregnancy complications.
Complications generally.
So, but possible side effects is the effect on your bank account.
Oh, yeah, that's a big
That's a significant one. And then the emotional involvement, because IVF all over the world is not yet 100% to guaranteed to give you a baby.
Okay.
Right? So you are there taking injections, you are there hoping and praying. You know, there's a lot of emotional turmoil, hormonal imbalances, which are involved in this process. So, mood disorders.
Yeah.
Not because the IVF causes the mood disorders,
but people are just
the process.
Anxious, right?
People are very
and then
anxious.
There's a lot of investment into it. I can imagine financial investment.
People take loans back home to IVF. And meanwhile, it is not 100% guaranteed.
Yeah, what I've also noticed is that people tend to do more than one IVF before they get results. Why is that?
Well, I would say that varies from couple to couple, and the reason for the IVF. Okay, we have the success rate at the first attempt for people who go through an IVF cycle in a woman aged less than 35 can vary from 15% to 70%. It now depends on where you are doing your IVF. So here is where I would recommend that you need to do it in a certified clinic, like a clinic with ISO certification, because who takes care of you determines how you end up. The quality of the lab, the quality of the procedures, because remember, these processes are things that happen inside the body.
Yes.
And now we're taking it out of the body to do it in a conditioned setting in the lab. So the quality of the lab, presence of, oxygen radicals in the air.
That's a big word.
Yes.
Okay.
Oh, presence of toxins.
Toxins in the air.
In the lab. Yes.
Okay.
Simple things as simple as the paint.
The paint of the room.
Yes. The location of the clinic, is it close to the highway where there are so many exhausts?
Traffic.
Yes.
So it's really, you have to be detailed.
You have to determine where you have. So if you are going to do it, I recommend you go for a certified ISO certified hospital or clinic to have your. Okay, if you're going to spend so much, you might as well do it
well.
Do it well.
Okay.
Yeah.
How long does the IVF process take from start to finish?
Okay, if you have your money.
Yes, let's assume yes, you have your money and you're ready to go. Okay,
so usually it varies from there are different cycles. It varies from 4 weeks to 8 weeks at times. If everything goes well, an average cycle is about 5 weeks to embryo transfer. So after embryo transfer, you wait 2 weeks to do the pregnancy test. Okay. So give or take 6 to 8 weeks, because you have to take over the woman's natural cycle. That takes about 2 weeks or 2 to 3 weeks, and then stimulate the ovaries to release the eggs, and then you retrieve the eggs after about between 10 and 16 days from the woman. Then you obtain the sperm from the man. Then the process between egg collection and embryo transfer is averagely 5 days. Some people have day 2 or day 3 transfers. So that gives us already like 4 weeks.
Yeah. Okay, so downtime for the woman. How many days will the woman not be able to go to work?
I would recommend that's between egg collection and the pregnancy test.
Okay, so how many? One day?
That's about 3 weeks.
3 weeks. Wow.
That's about 3 weeks. So there's also an opportunity cost. So you're not just paying, you are also not earning income for about 3 weeks. Yes. So after embryo transfer, we usually say rest that day and you can go about your normal activity, because if you are getting pregnant in your bedroom, you might not even know you were pregnant. So, but because you've paid so much money, you've taken so many injections, a lot of women don't want to work between the embryo transfer and the pregnancy test. So not that you are sick.
It makes sense.
It makes sense. Not that you'll be sick, but you know.
Yeah, you just don't want to take chances.
Yes. So
okay.
I would say you go for about 4 weeks.
So eggs can be stored, right?
Yes.
And the eggs that are stored can be used if the IVF fails. Is that
yes.
Correct? How long do you store these eggs for?
Okay, so because of the layman, I'm going to explain that eggs are what we get from the woman.
Yeah.
So after they've been fertilized with the sperm, they become embryos.
Okay.
So eggs can be stored for women who are advancing in age and want fertility preservation because they don't have a partner or they are not ready. So you can retrieve your eggs and store them for as long as you want.
Okay. That's good news.
That's good news, yes. It's new and it's working. Okay. I've actually personally handled frozen egg cycles that resulted in live birth.
Oh, that's good.
So back in Nigeria, yes. So but when embryos now...
Sorry, brain drain. But well done. Congratulations to the people involved.
Yes, with the Bridge Clinic, we achieved that, and it's now normal. But I was going to say, differentiate that embryo transfers. Embryos can also be frozen. Meaning after they've been fertilized, they can be cryopreserved for as long as you want. So if in the first cycle you have 10 embryos, we'll transfer one, the best one, and you have 9 to freeze, which you can use in subsequent cycles. And what it does is that frozen embryo cycles are cheaper than the fresh cycle because there's no egg collection, and then you have many more opportunities for embryo, like more chances of pregnancy with each cycle.
How many cycles of IVF might be necessary to achieve a successful pregnancy? Well,
with good preparation, one can get pregnant 25% of the time, and sometimes as high as 60% of the time the first time. But it is not 100%.
Not 100%. Okay.
And then one thing is to get pregnant, the other thing is to watch for the viability of the pregnancy.
Yeah, that's more traumatic.
I know.
Because then you are pregnant and then
it doesn't stay.
It doesn't stay.
That's where preparation comes in.
Yeah.
Preparation.
That was my next question.
Oh, okay.
What lifestyle changes or preparations should anybody watching us who is interested in IVF make before starting IVF?
Yeah. So just like for any pregnancy, preconceptional folic acid, making sure you have optimal health. You know, after investigations, the doctor who is the fertility specialist ideally should try and find a reason why you are not conceiving naturally and correct those reasons prior to going for IVF. For example, a lot of men who have low sperm count or azoospermia, meaning absence of sperm at all, is either that they have hydrocele or they have varicocele, or they've been exposing
to high
temperatures, hot baths. So those are things you want to watch out. Putting your laptop on your laps and cooking. Like I tell my children, you don't want to cook your testes, all right? And then...
That's not good.
No, you don't want to cook your testes.
I had a visual of that.
I think that's the only way I can make them understand that. So you don't want to, you know, expose your testes to heat. Wear proper underwear that allows...
The people that, you know, cross my mind a lot of times, I mean, when I was growing up in Nigeria, I know that a lot of the bus drivers
and long distance,
they always sit down where the engine is on top of that.
Yes.
So basically they are frying their testicles. So those are good candidates for not having children.
So that is the way I explain it to the layman. I say you don't want to cook your testes, so you want to, you know.
Okay, so no laptops on the laps.
On the laps, you want to put them on the table. And then you want to be of optimal weight. Both for egg quality, obesity is also a factor that...
For the male or the female?
Both.
Okay.
A lot of people with high body mass indices have poor sperm count.
Wow, okay.
And then they are not ovulating in the women, so that leads to infertility. So optimal.
So weight
is very important. Regular exercise, making sure your blood pressure is controlled. If you are diabetic, making sure all that is optimized. And then in terms of the reproductive system, prior to starting IVF, you want to do blood work to make sure that you do have eggs, because you don't want to spend money and then get to egg collection and there's nothing.
That's important.
Yes, that's important. You want to do an ultrasound scan to make sure that the womb you are going to put the embryo back in can actually take a baby.
So there's an unfair angle to this whole IVF thing, right? Because a lot of emphasis is placed on the woman. You know, I mean, the woman has
to the infertility thing.
Yes, to the infertility thing, because we've talked azoospermia, hypospermia. So this basically just means that the man does not have good quality sperm cells, or does not even have any sperm cells. It's producing the semen, but there is shooting blank, right? And a lot of times, I think the belief in many parts of the world is still that if a woman cannot conceive, it's the fault of the woman.
I think it's a mirage, because for couples, you know, when is the woman that is not, they are not seeing her tummy growing, is the woman that is not getting pregnant. So socially, is the woman the family is looking at. However, it's important to let the whole world know that males contribute as an equal percentage to infertility as females. Although most, in my own experience, a lot of times is a little factor in the man and a little factor in the woman.
Okay.
So it's just that Mr. and Mrs. A are not able to conceive together. Because if either of them goes and have another partner, sometimes
they may have.
So it's the little factor in the male and the little factor in the female.
Does things like stress play a role in infertility? Because a country like Nigeria, for example,
yes, that is so stressful.
The stress is, especially if you are living in Lagos.
Yes, you know, stress causes high cortisol levels, which also affects your ability to ovulate. Sometimes people are so stressed they are not even menstruating.
Yes, stress can do that.
Yes, so stress can do that. And then stress reduces coital frequency.
Yes, if you are stressed.
If you come back stressed, you don't want anybody to touch you, right?
Yeah, definitely. Even the guy.
Yes, you're not even thinking about it.
Sex is the last thing on your mind.
Or if he doesn't have money, right?
If he doesn't have money. Well, poor people tend to have more sex for some reason, because that's their DSTV, their cable TV, any form of recreation they have. But I think those are people who are poor and have given up, and they're just like, we are poor. This is our TV, right? So that's what. But people who are trying and really trying, they tend not to have time for that kind of thing. And lastly, I would like to go. I'm really grateful for this time. We mentioned earlier on, you mentioned in part earlier on, alternative fertility treatment. So you said IVF is at the end of the spectrum, right?
Yes.
So what are things that people should watch out for and try and do before they consider IVF? Because IVF is a procedure. Right?
Yes,
so it's not easy.
Yes. Oh no, it's not easy. All right. So for any couple who have been trying to conceive for 12 cycles or 12 months, and you're having regular intercourse of at least 3 to 5 times a week, I said it, 3 to 5 times a week, like every other day, and you've not been able to conceive after 12 months, you should be seeking medical help. All right, that is, we should be looking for why is it not happening naturally. All right, so but if the woman is already 35 years of age, you don't want to wait a year. You want to start investigating after 6 months. So during your first 12 cycles is when you want to make sure you're having timed intercourse, meaning that you want to get knowledge about when you ovulate. Are your menstruations regular? Are you having signs of ovulation, so that you can make sure you have intercourse at those times? So if the investigations show that nothing is wrong, there are many things we could try. Fertility doctors can supervise timed intercourse. We can do ovulation induction. Oh no, not watching you, just telling you when your fertile window is, and informing you of the particular dates that you should not miss.
Okay, so I'm conflicted, because my understanding is that if a man has hypospermia, for example, low sperm count, that he should ejaculate every day.
Yes.
Now, if a fertility doctor is supervising and is saying, so the man is ejaculating every day because that helps improve the quality of the sperm
I'm so
cells.
happy you know that, because that is new in the studies.
From university, right?
Yes, so a lot of people don't know, because when you have frequent ejaculations, the sperm volume reduces, right? But the quality actually improves.
Okay, so this is why I said I'm conflicted. So if you have supervised, because the family physician in me will say, this is when you are ovulating.
Yes.
I want you to have sex maybe 3 days before, 3 days after. Have sex every day for that period.
Yes.
But then I know that if we do only that, then the quality of the sperm cells is still poor. So what new studies are showing now is that just
daily ejaculations
every day.
Yes. Well, I don't know what hammer means, but you know what?
Oh, sorry. Yeah.
Daily ejaculations are recommended when you are trying to conceive. All right.
Okay.
Don't worry about the volume of the ejaculate, of the semen.
Yes.
Your quality of sperm is better, and then you are more likely to catch the egg when it is being released. So the timed intercourse is just a time to know that those are the times you must not miss. We all know that when the doctor says have daily intercourse, it is not really happening. So, but it's also nice to tell the patient that these are the times you must not miss. Then we can also, people who are not ovulating, there are medications that we use for ovulation induction.
Is there any medication for azoospermia?
Unfortunately not. But since we know that
so azoospermia means no sperm.
No sperm. So the way we combat that is to give antioxidants, because to improve the quality of the sperm, and then do surgical sperm collection. Because azoospermia means there is no sperm in the semen that is released. So, but if you can go directly to the testes to retrieve the sperm cells.
Oh, okay.
That is surgical sperm collection. Yes.
Okay.
You can go directly.
So you can go directly to
it, and that is a surgical procedure.
Freeze the sperm.
And you can freeze that sperm
and use it. But technology has really advanced.
Oh, technology! I'm sure it has. Even now, IVF just means you are getting the eggs and mixing it with the sperm in a dish overnight. Now we're going to ICSI. That's directly injecting the best quality sperm into the egg under the microscope. There are also things like IMSI. There's, so many new procedures that have been done. And another not new, but an advancement also that is available is for people who are already over 42, over 45, who don't have any more good quality eggs. Now you can have donor eggs or donor sperm, because there are some men whose testes are actually dead. So you can get donor sperm, you can get donor eggs without being promiscuous. Okay,
like
on that technology. Yes, like have a sperm bank or an egg bank. So you are not being unfaithful to your partner, and you're able to achieve pregnancy compared to the olden age.
Yes, when you have to.
Where you just go get a second wife, or just have a side chick to have a child for you.
Man. That also happens.
Well, very rarely.
There was a case that one of our lecturers told us about in Obs and Gynae, if you remember.
In UCH.
In UCH. I don't want to mention his name because he later became a politician.
Okay.
So he said there was this woman that came, and they explained everything and blah 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 blah, and she was the second wife, and she said, the first wife has 4 children.
There was a story.
And then the next time,
how are you doing it?
She went to the first wife, and next time she saw Prof, she was like, Prof, don't worry. The other one got paid for all this treatment. She said, no, don't worry, Prof. I already spoke to the first wife, so I know how
they will solve the problem.
There's some man along somewhere around their house. Yes, so that
who is donating.
So that
anonymously. So anonymously.
Yes. But you had to be in a kind of relationship.
Yes. So now technology has made it so that
you don't have to do that.
You don't have to go out of wedlock to do that. You and your husband would sign up in a sperm bank,
and you can actually.
And we have it in Nigeria. A lot of IVF clinics have sperm banks.
Okay. And I'm sure you can choose the qualities of the person that donated the sperm.
Yes.
Is it tall? Is it dark?
Yes, it's dark, it's fair. Yes.
And I want that sperm, right?
Yes, and he's intelligent, is this,
smart.
he's smart. But you won't know, if it's anonymous, you're not going to know his name.
Yes, but at least you will know.
But you know his blood group, blood type, height,
From your experience, do you think people are really accepting of using other people's eggs or other people's sperms?
In my experience, I say that a lot of women need a lot of counseling before they accept it.
Are the men more accepting in your experience?
It depends on the level of enlightenment.
Okay.
And I don't mean level of
education.
Economic. Yeah, I don't mean level of education or how rich they are, how enlightened they are, and how they've come to terms with their diagnosis. Because a lot of African men, because
I said somebody already had 2 children for me. What do you mean that I have a problem? Not doing that.
And then our biology changes.
That's true.
You could have had a child at 25 years, and at an older age,
you are not able.
You are not able to anymore.
Okay.
And that's where the IVF factor comes. So, but in reality, it can happen medically, right? Yeah.
Okay, thank you so much, Dr.
Oh, it's been fun.
It's always nice.
You're making me feel like going back into this.
I'm sure they will be happy to have you back at the bridge.
Oh, no, I'm okay. I'm now a family physician, and I'm loving it. And
I know, definitely.
But I don't think I will ever change.
Yeah, you are going for the fertility conference.
Oh yeah, I'm going for in Amsterdam.
In Amsterdam,
yes.
In 2 days' time.
Yes.
So you are still very much into the fertility.
Yeah, and I still do consult patients from back home. Because they've known the name, or people have treated in the past, and then I just refer them to somebody who can handle it back home.
Thank you.
So it's been a pleasure doing this.
All right.
Thank you so much, Derek.
Thanks for watching. I hope you learned from it.
Yes, and they can send in questions to be answered subsequently in the chat.
Okay.
Thank you.